So under special hematology test, we have PCH and PNH. Okay, so PCH stands for paroxysmal cold hemoglobinuria. Okay, so what is PCH? So PCH is the least common type of autoimmune hemolytic anemia. So most often seen siya in children who had viral illnesses, so such as measles, mumps, chickenpox, okay, yun, and ill-defined flu syndrome. Okay, yun. So RBC destruction is caused by a cold autoantibody referred to as a biphasic autohemolysin, which binds to the patient's RBCs at lower temperatures and fixes complement. Okay? So, yung cold autoantibody na tinatawag natin dyan is auto-anti-T. Okay? So, for us to diagnose PCH, we use the Donat-Landsteiner test. Okay? So, on your handouts is the classic Donat-Landsteiner test. Okay? So, the much more basic way of doing this test. Okay? Ito nasa PowerPoint is the um, modified method or other method. Pero Donat-Landsteiner test pa rin ang ating hinahanap. Okay? Actually, same principle pa rin naman siya. Okay? So, Donat-Landsteiner is also called your anti-P antibody or the Donat-Landsteiner antibody. Okay? Yun yung nagkakause ng cold hemoglobinuria or this disease. Okay? So, this involves the collection of fresh blood sample from the patient. Okay? The sample is maintained at 37 degrees Celsius after collection and the serum is then separated. Okay? So, 3 sets of 3 tubes labeled A1, 2, 3, B1, 2, 3, and C1, 2, 3. Okay? So, this contains patient serum and incubated at various temperatures with group O RBCs that express the P antigen. So, in this test, si tubes 1 and 2 of each set contains 10 drops ng patient serum. Si tubes 2 and 3 of each set contains 10 drops of fresh and normal serum as your complement source. And then, lalagyan natin siya na washed P-positive RBCs and then mix. So, after mixing, ipi-place natin sila sa ice bath for 30 minutes and then at 37 degrees Celsius after the ice bath. Okay, so biphasic incubation. Diba? Si PCH is biphasic in principle. Okay? So it has to be exposed first in your in cold environment for it to be activated. Okay? Pero complete activation occurs at 37 degrees Celsius. Okay? So in vivo, pero in vivo hindi niya kailangang ma-expose to cold temperature for it to act. Okay, that is that is only on in vitro. Okay, so yun yung principle ng Donat-Landsteiner test. Okay, so in-expose natin sila into cold temperature, binigyan pa natin ng P-positive antigen, P-positive RBCs, and meron pang normal serum as a source ng complement. Okay, so and then in-expose sa cold temperature to initially activate if meron ka ngang cold-reacting antibody. Okay, and then, babalik natin siya sa 37 degrees Celsius para ma-complete yung activation. Doon natin siya totally makikita, yung reaction. Okay. So, the 3 tubes are placed, 3 B tubes are placed in ice bath for 90 minutes, and then si C naman is at 37 degrees Celsius lang for 90 minutes. Okay, centrifuge and supernatant fluids are examined for hemolysis. Okay. So, ito yung magiging reaction. Okay. So, si tube 1 na patient serum lang, okay, pag ice bath followed by 37 degrees Celsius na positive. And then, negative here and negative here. Okay. And then, tube 2 patient serum plus normal serum, positive here and 0, 0. And then, to normal serum na walang nakalagay. So, walang reaction to all temperatures. Okay. So, PCH nga, cold reacting siya, cold hemoglobinuria, has, kailangan ma-expose muna siya to cold before it would fully react. Okay? So, si patient serum, okay, so, yan, na-expose sa cold. Yung na-expose sa cold followed by 37 degrees, nagkaroon ng hemolysis. Okay? So, ito din, expose sa cold, followed by 37, na-expose sa hemolysis. So, normal serum lang ng, normal serum will act as your control. Okay? So, wala siyang reaction sa lahat kasi wala siyang antibody. Okay? So, references nito is Rodax and so on. Yung other details nito, for example, is clinical manifestations. Ayan. So, for clinical manifestations, diba nga, hemoglobinuria siya. Okay, so, sabihin, merong hemoglobin in your urine. Nagpapass out in your urine. Kasi, nagkakaroon ng hemolytic reaction inside the body. Okay, so, pumuputok na siya, pumuputok na in your blood vessel, so ilalabas niyo siya, hemoglobin na lang. Hindi na siya RBC buo. Okay. So, of course, kapag maraming hemoglobin sa katawan, it will further degrade into bilirubin. So, increase din si bilirubin, and so on and so forth. Okay, you can all see that in your handouts. Okay. Next naman is for paroxysmal nocturnal hemoglobinuria naman. So, si PNH, okay, this is a rare chronic intravascular hemolytic anemia. Okay, so hemolytic anemia ulit siya. Okay, so for the clinical manifestations of almost the same lang sila. So, of course, hemoglobinuria ulit. Yan. So, hemoglobinemia, increase si bilirubin, decrease si haptoglobin. Haptoglobin is a protein which binds to free hemoglobin. So, since marami si hemoglobin, mauubos si haptoglobin. Yan. Yun. And so on. Yan. Okay. So, this is caused by the absence of CD55 and CD59 on the surface of the RBCs, okay, which renders them susceptible to spontaneous lysis by complement. Okay? So, it is caused by an acquired clonal hematopoietic stem cell mutation. Okay? It lacks the glycosyl phosphatidyl inositol anchored proteins such as CD55 and CD59. Okay? So, it is rare, acquired clonal blood disorder. Okay. So, cells have acquired somatic mutation of the X chromosome gene na PIGA. Okay. So, we have three types ng PNH. Okay. So, type 1, little to no hemolysis. So, type 2, partially lacking si CD55 and CD59. Type 3 naman is yung completely lacking si CD55 and CD59. Okay? So what are the tests for, different tests for PNH? So, you have sugar water screening test, sucrose hemolysis test, and si Ham's acidified serum test. So, sugar water screening test. So, this is a simple screening procedure for PNH. So, if active dito, sucrose hemolysis procedure should be if positive dito, the sucrose hemolysis procedure should be performed before a diagnosis of PNH is made. Okay, so, ang ginagamit natin dito is whole blood mixed with sugar water solution and incubated at room temperature. So, si sucrose hemolysis test naman, okay, so this is the confirmatory test for PNH when the sugar water test is positive. Okay, so results should correlate with your acid serum test. So, washed RBCs are incubated in an isotonic sucrose solution containing normal ABO compatible serum. Si normal ADO compatible serum, it contains complement to help with the lysis. Okay, so di ba nga, this disorder causes the RBCs to be susceptible to lysis by complement. Ham's acidified serum test. Okay, so this is a reliably used to diagnose PNH. Okay, so normally, no hemolysis sa makikita natin with all the tubes. And then PNH naman, madadiagnose natin PNH kapag nagkaroon ng hemolysis except sa tube number 3. Okay? For the procedure, it is all indicated in your handouts. Kindly read na lang po. As is lang naman yan, kung ano yung nandyan, yun na yun. Okay? Yan. So, what are the major clinical manifestations? Sinabi ko na kanina. Anemia. Yan. So, since hemolytic anemia nga siya, so of course, may anemia. Hemoglobinuria, chronic renal failure, and cholelithiasis. Okay. Okay. We can also see venous thrombosis and arterial thrombosis. Okay. So, myocardial infarction, ayan. So, portal hypertension, cerebral vein thrombosis, and retinal vein thrombosis, and loss of vision. So, related to bone marrow failure naman, okay? So, we can see pancytopenia and myelodysplastic syndrome. Okay, so that's it for special hemo